Good evening, everyone. Welcome back to You and Your Health. Thank you for tuning into our program this evening. If you're watching the program for the first time, my name is Erika Roberts, and I have my co-host, Dr. Edward Suman. Hi, Dr. Eddie. I was
Hi.
wondering whether you were there.
Yeah, I'm here. I'm multitasking, so
I know. How are
yeah,
you?
I'm
So,
here.
are you excited about this evening's program? We
Very,
have
very
two.
excited. We have our very own Ricky and Vicky. Oh, sorry. It should have been a surprise to them, right? Yeah. Okay.
The Martin siblings,
Yeah.
Dr. Vicky Drama and Dr. Vicky Martin, both of whom are pharmacists. So I'm excited for us to have them
Mhm.
have a discussion on over-the-counter medications because everyone takes over-the-counter
Yeah.
medications. We want to
Yeah.
make sure that
Yeah.
people are not taking medications that have contraindications with other medications that they're on, as well as side
Mhm.
effects. So I'm glad that they were able to accept our invitation.
I hope they will talk about antibiotics.
You hope they'll talk about antibiotics. Are we
Yeah.
talking about Ghana specifically or here?
Yeah, maybe
Because
they would
here,
have to. If they don't talk about antibiotics today, they would have to find time and talk about antibiotics because Ghanaians, try to abuse antibiotics a lot. Yeah,
exactly.
yeah.
Yeah, yeah. So
Okay.
anyway, because of time, let's get
All
started
right.
on this evening's program. And as always, before we start on our discussion, we want to thank our prior guest, and that's Dr. Albert Kwashi, for his excellent discussion on dental restoration and options we have for teeth replacement. So if you haven't watched that program, we suggest that you do so. And please, as always, share with others as they too may benefit from the discussion. So we're going to get started this evening with our discussion with both doctors, Vicky Drama and Ricky Martin. Before we get started, let me tell you a little bit about their background. So Dr. Vicky Drama is a board certified pharmacotherapy specialist and a clinical pharmacist at the Frederick Health Hospital. She received her doctorate in pharmacy from Hampton University School of Pharmacy in 2006, where she graduated with honors. Her role as a clinical pharmacist is to use evidence-based medicine to provide optimal pharmaceutical care for her clients. Practicing evidence-based medicine allows her to teach and to treat each patient holistically with guidelines-directed therapy, which improves clinical outcome. Dr. Drama enjoys her role as clinical pharmacist, especially the educational aspects of the profession, which includes ensuring the proper use of medication. Besides her professional role, she's a wife, a daughter, a sister, and a friend. And one of the most important blessings that she said that's a blessing to her is a blessing that God gave her, which are four children, four handsome grown men, whom she's trying her best to train. Um, Hello, Dr. Drama.
Good evening.
Thank you for joining our program. I know that you have a busy schedule, so we certainly appreciate you joining our program. I'm going to do the introduction of your brother, Dr. Ricky Martin, now, and then we can all get started. So Dr. Ricky Martin completed his pharmacy training at Hampton University School of Pharmacy, the same school as his sister. Thereafter, he completed his residency training at Sinai Hospital in Baltimore, Maryland. Dr. Martin is board certified in both pharmacotherapy and critical care. Clinically, he manages the pharmacotherapy of patients admitted to the surgical ICU at Sinai Hospital. He also currently serves as a surgical critical care pharmacist specialist and the director of their residency program at Sinai Hospital in Baltimore. And as a director, he's responsible for the training for the clinical pharmacists in the hospital setting. So, Dr. Martin, thank you as well for joining our program this evening.
Thank you. Thank you. It's a pleasure to be here.
We've been waiting to have you both since we had your brother Michael
Oh,
some months back, and so we're grateful that both of you, based on your busy schedule, were able to take some time to have this discussion with our members, the Beniza, and everyone else that's watching our program.
oh,
Um,
no problem.
so,
Yeah, he's set the stage, so we're trying to follow up after him. He set the stage with that presentation, and after I saw it, I was inspired myself. So if he happens to be listening, which I'm not sure if he is, so he set the mark, and it took two of us to follow up after that.
I wouldn't necessarily say that, but he definitely did. He definitely had the push for you two to come on, and we
Right.
appreciate him as well. And so if you're ready, because of time, we're going to get started with the presentation, and Dr. Eddie can help to project the slides. So
Okay.
whenever you're ready, you can go ahead. And I think you mentioned that we can stop in between if some of the viewers have questions.
Yes,
So we
yes.
can go ahead and do that. Okay. So
Okay,
over to you.
excellent. Excellent. Well, again, thank you for having us. We really appreciate the opportunity to share the knowledge that God has gifted us with to everybody. Our goal between the two of us, actually, I'll give you guys a brief story. Ricky and Vicky, similar names, like we're twins, but we're not twins. We were just speaking earlier this year, and it was something that specifically that was on Vicky's heart to wanted to give back to the community, specifically our Ghanaian community, but the community at large where we live, our Ghanaian community, everything that we've been given, especially in the field of health and especially in the field of medications and pharmacotherapy. So the opportunity to be on this platform is something we don't take lightly. It came to us, and immediately, without hesitation, we wanted to step forward and share. So this is number one, and we hope everybody gains something and enjoy from it. And like you said, at any point, feel free to interrupt it. We want to make this conversational style. We want to be able to answer any questions that might be in the chat or any questions that you might have throughout the presentation. But without further ado, I'll go ahead and get started. So today we're going to be talking about over-the-counter medications, its safeties and misconceptions. And we'll start to say that out of all the drugs we're going to talk about, we don't have any relevant financial relationships with any of the manufacturers, maker of the drug. We're speaking strictly from the pharmacotherapy and the medicine that we have been training in over the past years. I have been a pharmacist for almost 10 years, and Vicky has been a pharmacist for 16 years. 16 years.
16 years.
Yeah, 16 years. Yeah. So hopefully the combination of that, we'll be able to answer something today. So over-the-counter drugs use in the United States. I chose the U.S. because we are based in the United States, but these numbers can be applied to many countries around the nations. 78% of people routinely use analgesics over the counter. 52% take cough and cold medications. 45% take allergy medications, and 37% take heartburn medications. So we can see that clearly the use of over-the-counter medications is something prevalent across the United States. But check this fact out. Only 20% actually check for the active ingredients. What does that mean? Most go to the pharmacy. They just look at whatever the pharmacy has well branded and displayed the particular section to, or whatever the drug company has well branded and displayed the box of the medication to, and select their medication off of that without looking for what actually is treating their symptoms that they may be having at that time. Only 20%. Another interesting fact is that 33% or 1/3 admit to taking more than the recommended dose if they do not obtain relief or if they believe it will relieve symptoms more quickly. And reading that, that just took me back. It was an astonishing, a good 1/3 of people. And the fact of the matter is why we decided to do this presentation is that little people, not many know the effects of doing that. Not many know the long-term effects, what it may look like or how it might manifest 10 to 15 years from now. And not many know the short-term effects. So our goal is to try to touch on that and to capture that although, you might, let's say it says take Tylenol, take 1 tablet, you end up taking 3. Who knows? You might be good for the one time, but who knows what long-term effects that had on your liver or any of the subsequent sequelae that might happen from that. So that's up to 1/3 of patients. 28% take 3 or more over-the-counter drugs per month, and OTC means over-the-counter. Put that out there. And only last stat is 25% read the label for dosage instructions when taking OTC medications for the first time. Now think about that. Think about that. Only 25%. So you go in there, you take a cough drop and or a cough medication, and it says 15 milliliters. What do people do? Or it says 1 teaspoon or tablespoon. If you can ask in the chat for me, this would be a very good question. If somebody can tell me in the chat, what's the difference between a tablespoon and a teaspoon? That's all I want. If somebody can tell me. That's it.
So I have a question regarding the drug label.
Yes.
Are the drug labels based on FDA rules?
Yes. So all the big manufacturers in the United States, whether it be Merck, whether it be Pfizer, companies that make these drugs, they have to adhere to strict labeling, as detailed down to the font, as detailed down to how many words you can have on one side of the box. So everything that's on the drug label all looks the same. And luckily for you guys, we'll go over an example of a drug label, and everything is supposed to be uniform so that one can be able to quickly assess what's in the medication. So it is based on FDA rules. The tricky part comes when there are homeopathic medications or not medications which are not FDA labeled, but they're out there as maybe dietary supplements or something of that nature, in which they don't go through that FDA processing because they don't want to consider themselves a drug. That's when it gets tricky, and hopefully we'll be able to get to touch on that.
Rick, let me chime in real quick. So
Sure.
Over-the-counter medications are still regulated by the FDA, like he said. It's not homeopathic. It's not considered natural medication. So they still have to go through the rigorous trials in order for them to be approved. They're safe to be used, under the advice of the physician or per the label instructions. So it is still medications that go through the rigorous FDA approval process.
Okay, so the key is really to be familiar with the drug label if you want to prevent overdosing of medication with similar active ingredients.
Exactly.
Right. Okay.
Exactly.
Okay. Thank you, too. No
problem. So we'll move on to some other safety statistics, and this is particularly in children. And this one was very astonishing as well. Approximately 50% of adolescents begin to self-medicate as early as the age of 11. Think about that. 11 years old, 12 years old, they start pouring their own tablespoons of cough drop or teaspoons of cough drops. 10,000 ER visits per year for patients who are younger than 18, caused by medicine errors and misuse of OTC medication. So the importance of this is across the spectrum, because it's very important for us for the parents that are in the group to understand what they're giving to their little ones as well.
Dr. Ricky and Dr. Vicky, which one is the tablespoon and which one is the teaspoon?
The teaspoon is the smaller one, and the tablespoon is the big one.
Okay.
Yes. Yeah. Thank you, Dr. Eddie. And that one, we had to bring the mother of 4 children to be able to answer that. She is readily understands the difference. Yeah. But yes. So it's important. It's important specifically for the kids, specifically. And in short, a big part of this solution is education. And the more we educate ourselves, the more we can help ourselves. So that's what I'm just stressing here early in this.
I'll add something real quick about the kids.
Sure.
In pharmacy, kids are not little adults. So we have to keep that in mind. They break down medicines differently. So we have to definitely keep in mind that the concentration of a medicine makes a huge difference when it comes to giving it to a child. So labeling, like you said, is very important to follow the instructions as it's been written and ask questions. Pharmacists are there, your physicians are there, your nurses are there, but definitely ask questions.
Yeah. So what are some of the common over-the-counter medications that you see children have?
Well, and that will be part of the presentation too, but Tylenol is one of them. Yeah, okay. Motrin, Tylenol, allergy medications. Yeah, those are all very common, especially the allergy medications. So, yeah.
Okay, because some folks may not necessarily know the common medications that they typically get from over the counter, or may not classify it as over the quote unquote counter medication, even though they are purchasing it. So, thank you for clarifying that.
Excellent. And at the same point I want to make here is that medicine are drugs. Drugs are medicine. Essentially, these are foreign substances. A big term that we use in pharmacy is xenobiotics, and these are foreign substances to your body. And these medications are mimicking structures that may be innate or not even innate to our body. So the safety of using something that is foreign to our body is of the utmost important. Our body is the temple, right? Is the temple of the Holy Spirit. So it's up to us to make sure whatever we're doing, we have a billion brain cells, and God gave us that to ensure that whatever we're doing with our bodies, whether it be physical or medication use, we have to take care of it to the highest degree. I just wanted to point that out here. If you could ask in the chat for me, who has used over-the-counter medications in the past week? I want to see who in the chat potentially has used it. I'll come back once it populates. I'll come back to it. You don't have to ask about some use for OTCs, but I just want to know if anybody can raise their hand or say so they've used over-the-counter medications in the past week. So we'll come back to that. And we'll talk about briefly just the difference between prescription and over-the-counter medicine. So a prescription medication, so this is for definition so we can understand, and this is the United States. Prescription medication is prescribed by a doctor for one person. I repeat, for one person. A lot of people, they take a medication, they take an antibiotic. Oh, that looks like cellulitis or a skin infection. You should try it, you know. So it's for one person. And it's bought at a pharmacy and dispensed by a pharmacist. And here, 99% of medications are dispensed by pharmacists here. Used by only one person in a family is prescribed for. I'll switch over to the over-the-counter section, is you can buy without a doctor's prescription. It's bought on the shelf in the store of the pharmacy aisles. It may be used by more than one person in a family for the same symptom or problem. Both types of medicine, the medicine label, including the directions, should be read, followed carefully before use. Both of them have specific labeling. Children should use only with the permission of a parent or trusted adult, which is very clear. A healthcare professional or poison center can answer questions about this medicine and dangerous to misuse or abuse. So the key here is that prescription is prescribed for one person, whereas over-the-counter is not the case. Over-the-counter medications are generally used for mild symptoms in which that it's not associated with major issues, or the adverse effect profile of the medication is not as something as such that needs strict monitoring. Whereas prescriptions, on the other hand, the adverse effect profile, the potential for side effects is high. The risk of, and with the use for the medication tends to be more of a serious problem. So just defining prescription versus over-the-counter medication. And the risk versus benefits of both. So the benefits of OTC medication is easy and quick. As pharmacists specifically, we like to think of ourselves as the frontline healthcare providers, specifically those in the community setting. Vicky and I, we actually don't work in that setting at this time. We're in the hospital. But those in the community setting are the front line. If somebody's sick, if you have something, you go directly to your pharmacist, who is right there where the over-the-counter medications are. There's a diverse availability of the medications. Is associated with lower healthcare costs, because essentially you're just paying for the cost of the drug, but you're not really paying for the consultation. You're not really paying for a physician to see you, and enables patients to select from various treatment options. Some of the risks, again, it's not without risk, is the possibility of incorrect self-diagnosis. You think you have heartburn. You think you've eaten and your chest is burning a little bit. So you say, I'm going to the doctor's office. I'm going to the pharmacy, and I'm going to get an antacid. I'm going to get a drug called Protonix, or a drug or Prevacid, or a drug called Pepsid to decrease the heart. One may not know that could be a heart attack. Another may not know that it could be the first signs of a malignancy. You might not know, but you might have an infection called H. pylori infection, which is all associated with the same symptoms, right? So that's one of the risks associated with OTC use, such as that. So it's very important, what we'll talk about shortly in this presentation, to identify the cause of those symptoms. Treating symptoms is okay if you know what's going on, But if you haven't identified that cause, you might be putting yourself for risk for something way worse. The second point, increased risk of drug interactions for multiple medications. Increased risk of adverse events if not used properly, and use is associated with potential misuse or abuse. Yes. Vicky, any interjection here at this moment?
No, you're good. You want me to take over the next slide?
No.
Mama's on.
Oh, okay, yeah. We got a message here.
Vitamin D was used over the counter this week.
Yeah, vitamin D was used over the week. Okay, good to know. So what we have here is a label, and this label is in the back of all over-the-counter medications. And the key I want to point out from here is if you don't take away anything from here, the term active ingredient is something that everybody should know.
Dr. Ricky, can you
Yes,
please
sir.
expand the label to show the active, showing
Okay.
active ingredients?
Let's see if I can do that.
Yeah, 100%.
On that side, yes.
Yeah, yep. And then we might be,
Yeah, that's the very top.
Okay, can you
part
see
of the label?
Mm-hmm.
Yes.
Okay, all right. So here we are. Let me see one moment here. Okay, yeah, I can see a little bit to the right. Perfect. Okay, so active ingredients. These are what is actually causing the effect in your body. This is the substance that causes the effect that you are looking to have. So for example, this example says medicine 100 milligrams, cough suppressant, medicine 150 milligrams, nasal decongestant. This active ingredient is where you will see the actual name of the drug. The name what might be on the box is usually a trade name. It's just a name that the manufacturer created to use to be able to easily identify the drug or easily say the drug or market the drug to the masses. But what the actual ingredient is on the back and is the first on the back label. It says active ingredient. And you want to begin to actually familiarize yourself with the active ingredient. So for example, the active ingredient of Tylenol is acetaminophen. Tylenol is just the brand name, but acetaminophen is the active ingredient. So you can look in the back of the box, you'll never see Tylenol, because in some countries, what do they call it? Paracetamol. Never seen that in my life. Yeah.
Some countries or your country?
I've never seen the word paracetamol on the box before in my life. All I know is Tylenol in my life, but I've heard of some people say paracetamol before. So acetaminophen will be the brand name. So active ingredients. You also get to see the use of the drug, what it's used for, or what the drug company is purporting that it works for. Right after that is the warnings that are associated with the medication. I'll continue to scroll down. And the second most important thing I would say is the directions. The directions are in the back of the box, the storage information, what kind of temperature you should store it. And then you have a whole list over here that says inactive ingredients, right? So active versus inactive ingredients. What's the importance of what does the inactive ingredients do? The inactive ingredients are things that hold the drug together, give the drug the stability, give the drug potentially its look, but it's not what's causing the pharmacotherapeutic effect that's associated with the drug. That's the active ingredients, and that's what we need to know. From a consumer standpoint, from a patient standpoint, from somebody who's taken the drug, what does inactive ingredients mean to you? What I would say for that matter is mainly allergy information. If you are allergic to particular substances, you want to check the back to make sure that any of the inactive ingredients are not associated with what you may be allergic to. But for the inactive ingredients actually plays little or no to little part in the pharmacologic effect of the medication.
So I have a question about this. I used to get this question from GYN patients.
Yes.
As to which part of the drug label is actually beneficial to them, whether it's the warning signs or the direction, which one should they follow? And I typically say both, but I know there is a true answer.
It's a good question.
Yeah. So what I was going to even chime in before you ask that question, Erika, is for me, the warnings or before use, you should ask your doctor if you have the following such and such and such. For me, that's one of the biggest places you should look at before considering taking the medication. And for me, I always counsel my patients, always ask your provider, especially your primary care doctor, because there's other disease states that someone who recommended you to take this over-the-counter medicine may not be aware that you have, whether a kidney problem, a liver problem, a stomach problem. So ideally, your primary care doctor should have your whole history, under one umbrella. So for me, that's one of the most important. Besides the active ingredients, the warning section is one of the most important sections.
And so should people take into account the minimum amount of time that they should re-administer a medication? Because since that's what kind of the total dose is what could cause an overdose, right? Similar to Tylenol, like more than 2,000 milligrams a day. So they really should keep track of that. I'm not sure if folks do or not. And where on here, I guess it would be another the direction part that they should pay particular attention to as to how frequent they can actually take that drug within a 24-hour period.
Exactly. Yeah. Would definitely be on the directions part.
Yeah. And then the interesting part about medication is that as far as how often you should administer, it might be different from me, from you, from Ricky, because how long it takes for my body to break down is going to be different from yours. So I might require every 6 hours. Ricky might require every 4 hours. So just because the label says I can repeat it every 3 to 4 hours, I should definitely see how it's working in my body and then ask my doctor before, because I've had so many situations where they're taking it way frequently, even though the label says you can take it every 3 hours, but they might be on a medicine that doesn't jive well with it. And that might introduce some issues.
Yeah. And then another example was what Ricky had mentioned earlier, like having cold medication and then perhaps taking Tylenol, quote unquote, acetaminophen. There might be, the acetaminophen isn't most cold medications. So now you have double dose of the same ingredient. That could be a problem. Okay.
Exactly.
Thank you.
All right. So moving along here, staying mindful of time. And
there they are.
Right here. Let me back out a little bit. So how do you decide which OTC medication is right for you? If all of the other things we have said doesn't work, I have a better option. A better option is speak with your pharmacist. Speak with your physician too, but speak with your pharmacist as well. Your pharmacist is likely privy to the list of the entire medication list that you have. They are highly likely to understand if there are any drug interactions. As pharmacists, we consider ourselves drug experts. Physicians are very well depth in the understanding of so many things, of diagnosing and treatment as well, and laboratory evaluation as well as radiologic evaluation, looking at chest X-rays and CTs. For pharmacists, we thank God that we've only have one job to do. It's to deal specifically with the medicine, right? So it narrows it down. Very, very specific. So that's what you should do if you're not sure. Speak with your pharmacist. And I'll tell you this, sometimes people don't like asking maybe their family members or friends or something about it. You think you don't want to bother them. I have never been bothered by somebody asking me a question. I don't, at no time of the day. I usually get messages throughout the entire, after I leave work, the messages continue to come throughout the day. But it's never been a moment where I've been hesitant to answer the question. So, and I think most pharmacists feel that way. I can speak for the community saying that most people, pharmacists feel that way. So I would encourage you without hesitation to ask your local pharmacist.
Except you don't have samples, correct?
Yes.
That is what
yeah.
That's the question, and they want a little bit of the medication as well.
Yeah. I don't have anything. I don't have any medicine for you. Don't keep it. If it was somewhere else, I might, but not.
Okay.
Yeah. All right. So we're moving into some of the categories of over-the-counter medications. There's so many: cough and cold, gastrointestinal products, topical things, oral care for your oral hygiene. There's women health things. There's family planning things over the counter. A whole segment is vitamins and dietary supplement. I know people have questions about that. We're not actually talking about that today, but That's a common one that comes up. First aid, pediatric, ears, eyes, nose, and throat medications, pain and inflammation, and diabetic healthcare. And this is to name a few of the categories that are just over the counter for you to pick up. This is not the categories of medicine and overall. So we're going to narrow it down today, and we're going to talk about pain and inflammation. We're going to talk about pain medications. We're going to talk about cough, cold, and allergy medications. And we're going to talk about medications that affect your GI tract, your gastrointestinal medications. We've decided to narrow it down. However, if you have a burning question that's on your heart that you know that you must answer, you must have answered, feel free. There's no question that we can't help you with.
But you're going to come back anyway another time to talk about more.
Yeah, there's definitely more. There's more. So we're going to start with pain and inflammation, and I will leave that to Vicky to continue.
Okay. Any questions so far before I start?
Yeah, Dr. Egg, do we have any questions in the chat?
No, it's full of enjoyment. I think people are happy. People are happy listening to the nice conversations that we are having. And,
that's right.
Okay.
Yeah.
Okay. All right, so you can go ahead.
All right. So I will start with Tylenol. The name, as Ricky mentioned, the long name, acetaminophen. It does come in various strengths. You know, I often get this. So Tylenol comes as the regular strength, which is 325 milligram. It comes as extra strength, which is 500. And then it comes as arthritis strength, which is 650. And thankfully, with the children's Tylenol, it only now comes as one concentration. But years ago, when I graduated from pharmacy school, they had the infant version and then they had the children's version. But there were a lot of overdosing between the infant and the children, lots of hospitalization because of Tylenol overdose. So the FDA came up with one concentration for the children, which is great. Easy dosing. There's always like a calibration tool that comes with it. As you can see, the recommended dose is 650 to 1,000 milligram every 4 to 6 hours as needed. You know, but for me, the general rule of thumb is even if you can take one tablet of the 325, it could be like an elderly, frail patient that could get relief from just one tablet of the 325. It's perfectly okay. Or start with 500 milligram versus 2 tablets of the 500 milligram. Because when you read the label, normally it says 2 tablets every 4 hours as needed. You know, so the lowest effective dose is what we generally recommend. The main reason that we decided to talk about Tylenol the most is that, you know, it's one of the primarily used pain medications over the counter. And this fact, I thought it was very interesting. There's over 600 medications, both prescription and over-the-counter products that contain Tylenol as the active ingredient. So you can almost see how much is, you know, worldly used or widely used. And another interesting fact that I saw, Tylenol overdose is actually the most common cause of acute liver injury that we see in the United States. Because the way that your body breaks it down is heavily broken down by the liver. Sometimes you pee it out through the kidneys, and sometimes the rest of the metabolites, which are the medicines that are left over, your liver uptakes it. Over time, it might accumulate and your liver might become compromised. So Tylenol is not to be used without any, you know, notion that it can cause injury. I know a lot of people, you know, might go out to a party. They might get themselves like a drink, and then they go home, they have a headache, they take Tylenol. You know, so you have to keep in mind, alcohol and Tylenol is not a good combination, especially if it's done frequently. It is a safe medication generally. And as you mentioned before, there is a maximum amount per day that you should not exceed. And it might be smaller for an elderly patient. So like someone like a young adult in their 30s, they might require what we call 400 milligram of Tylenol per day. But an elderly lady, we might say no more than 2,000 milligram per day, because you might be on other medicines that can interfere or that also is broken down in the liver heavily. So we're trying to preserve, you know, that liver that way that there's no harm being done. Tylenol is generally used for headaches, pain, whether arthritis pain. it doesn't have any anti-inflammatory effect, meaning that it doesn't reduce swelling. So there's other options that are available over the counter to use for swelling. Let's see. But otherwise, Tylenol, it is a good medication when it's used based on what the labeling instructions provide. Okay.
So a quick question. So the whole concept of alternating between ibuprofen and acetaminophen for inflammation is not necessarily true.
Interestingly, recently, especially for due to the opioid pandemic, okay, Tylenol is an effective analgesic, especially doses over 500 to 1,000 milligram in combination with lower opioid medicine. It does help with pain relief, just to minimize patients being addicted to, opioids. So it's very effective as far as the pain medication, but it does not have any inflammatory effects. Yeah, none at all. Like if someone has a sprain or, I don't know, Ricky, what else causes inflammation? A sprain for sure, or
it's usually pain or malignancy. Bone pain is another inflammatory bone.
Right, none of those.
And I would add, just like Vicky said, it's really because of the opioid epidemic. It's a true epidemic. The number of deaths that are associated that all start with prescribing opioids from a hospital for something maybe minor and leads to an opioid abuse and heroin abuse is really the reason why Tylenol and ibuprofen. So if you go back and forth between Tylenol and ibuprofen rather than taking oxycodone, Percocet, hydromorphone, Dilaudid, you are much better. You're much highly likely to save yourself from that. So
right. And then may I add? I mean, also ibuprofen is broken down by the liver, not as extensive as Tylenol, but the combination, especially if you use it for a long period of time, can add to the liver injury. So like herbals, I know we do a lot of herbals where we come from, and some herbals, a lot of people don't know that it's not necessarily always safe for liver issues. So when you combine it with Tylenol, that can also introduce some not so safe things. So the next class of medicines, I'm just going to group them together. I know Ricky is showing the aspirin, but there's a class of medication called non-steroidal anti-inflammatory drugs. And that includes aspirin, ibuprofen, and naproxen. There's some that are prescription that are also considered non-steroidal, but we'll just talk about the over-the-counter ones. So there are 3 that I mentioned. And we can go back to the other slide with the aspirin. Thank you. So aspirin, to me, when I think about aspirin, my first thought is that aspirin is not a pain relieving medication, but it is available as an over-the-counter medication for pain relief. And the recommended dose as written over there, 325 to 650 every 4 hours as needed. I wouldn't go to aspirin as my first line of choice for pain relief. Definitely Tylenol first. Aspirin generally has, they call it antiplatelet. It has a protective function for the heart. So ideally, they prescribe it for people who've had strokes or heart attacks. Okay, so be mindful and aspirin again has different strengths. It comes as the baby aspirin and then your regular strength that Ricky has placed on the slide. So there's Bufferin, there's Ecotrin. Definitely, I would say avoid aspirin if you can. Ricky, correct me if I'm wrong. Right? Is it pain relief?
Exactly. Originally, that was the original intention of the medication.
Right.
It was highly used before all the other NSAID or non-steroidal medications. Now, because of the bleeding risk associated with aspirin, especially at these doses, the other drugs are highly preferred. So we have it here just to include everything, but aspirin is really not, at these doses that are listed, it's really not your go-to pain.
Your go-to. Yeah, as he was saying before, it does. There's a protective function in the GI tract. Aspirin, removes that protective function. In that whole class of drugs, they do that. So there's an increased risk of stomach ulcers and stomach bleeding. And those class of medications are not the best for patients with kidney disease. So we have something called acute kidney disease and chronic kidney insufficiency, especially patients with chronic kidney insufficiency. There's a lot of like the kidneys are not able to filter out waste. And a lot of medications are broken down and eliminated through the kidneys. So if you're not careful, there's a buildup and there's an increased risk of side effects. So with all of the medications that we're going to be speaking about, if you have something called chronic kidney disease, or if someone has said you had like liver failure or your liver enzymes are high, it's something that you want to discuss with your provider before you start these class of medications.
Yep.
But like Ricky said, it was approved to be used for headache, general aches and pain. I know sometimes like cold products have also aspirin as part of the active ingredient. So be mindful. A lot of people, stroke and heart attack are major conditions that, a lot of folks we know have experienced. So a lot of time those patients are already on baby aspirin. So we don't want to go and add, an over-the-counter aspirin on top of what they're already taking.
Exactly.
I know when COVID started, people were taking aspirin, whether it's baby aspirin or regular dose aspirin, supposedly to help prevent them from getting COVID. I haven't heard it lately, but I know that was a big thing.
Right.
When it first came.
Yeah, studies came out to show that COVID was associated with high risks of venous thromboembolism and clotting. So the aspirin itself was used to prevent and as primary prophylaxis those things, but nothing has come out that is of consequence to say that aspirin can help. Yeah. Those were all pandemic associated medications that people came out with that is now debunked. But I just want to say before we move on to the other NSAIDs is that if you've been prescribed aspirin and baby aspirin, it's a great drug for that intended purpose. Yeah, but it's just we're talking about pain here. So if you've been prescribed 81 milligrams or baby aspirin that you just take one pill a day, or even 325 once a day. Yes, because if you have a history of a heart attack, maybe you might have a history of diabetes, you have history of stroke, or they put a stent in you for some reason. Those are all the reasons you'll be on aspirin. So, or if you have peripheral arterial disease. If you have that, aspirin will save your life. Right. But if it's for pain, you probably should choose something else.
All right. Like Ricky said, if you are on those medicines for those conditions that he mentioned, Tylenol will become your preferred pain relieving medication in appropriate doses. So the next slide will be ibuprofen. And ibuprofen is also frequently prescribed, especially for headaches and fevers that are unrelieved by Tylenol. It does help with inflammation. So with sprains and strains or menstrual cramping type of things, it is an option aside from Tylenol. The dosages are normally 200 to 400 milligrams every 6 hours. And just like aspirin, that risk of the stomach bleeding is there. The one thing about ibuprofen I wanted to mention with aspirin is that, like we said before, some patients are prescribed aspirin for those conditions that we spoke about. But a lot of people are not aware that if you take ibuprofen the same time as you take aspirin, you don't get the heart protective benefits of the aspirin. So you have to separate it anywhere from 2 to 8 hours, depending on if you take the baby aspirin, which is a regular release. There's also like an Ecotrin, which is a longer release. If you take the longer release aspirin, you should wait about 8 hours before you take ibuprofen, just to make sure that the aspirin is being absorbed and it's giving you that protective function that it needs to give you. I wanted to throw that out there. But otherwise, ibuprofen is the lowest effective dose, 200, 400. I've seen a lot of people take 600 and they will pop a few pills of 600 continuously. And then they come to the hospital with stomach bleeds or even kidney injury. Patients with high blood pressure, you have to be very mindful of taking ibuprofen or naproxen because it can cause fluid buildup in the body. And so your blood pressure tends to be on the higher side if you do take these types of medications, what we call chronically. Like if you take it beyond 3 months, it becomes a chronic medication. And these medicines are not intended to be chronic medications. They're supposed to be only taken as needed.
I think the name that most folks may be very familiar with is Aleve.
Aleve, exactly.
So,
yeah. So we
And I
have
have a quick question.
Yeah.
In terms of baby aspirin, like, does it matter whether folks take it at night, like before bedtime or in the morning, or doesn't matter?
I would say no, Ricky. Yeah, I would say it doesn't matter. We just like to say to minimize like the stomach pains that people experience from it. We just say take it with food, just like the other NSAIDs, like the naproxen and the ibuprofen. Just take it with food. But it's, as far as timing, no.
Okay, thank you.
You're welcome. And the stronger one out of the three is naproxen in the sense of pain relief. And naproxen generally comes as 220 and 250 as well. Typically is every 8 to 12 hours, but I definitely always tell my patients no more than 2 tablets of the naproxen or they'll leave in a day span. Just like the approved indications for the ibuprofen, you can use it for headaches, you can use it for muscle pains, and it does give you the anti-inflammatory benefit. And side effects are very similar to the aspirin and also the ibuprofen. The stomach ulceration that it can cause, leading to stomach bleeding, and then also affecting the kidneys, because these medicines are, again, broken down through the kidneys, and that's how your body gets rid of it, through, urination. So keep in mind that all these medications, if you take it in overabundance, it could be very detrimental to the kidneys. Do we have any questions?
Dr. D, do we have any questions from the audience? If not, we can go to the next slide.
Yeah, I think Ricky can go to the next slide.
Okay.
Yeah.
I'm watching our time too. You don't have to rush through because I just plan on having you guys back.
Yeah.
Are you still coming to talk about my tablespoon and teaspoon?
We brought it back one last time.
Yeah.
Oh, goodness. So cough medications, cough medications generally are safe to some degree. What I can definitely say, and Ricky, you can add what you are able to, a lot of them have combination medications that are not necessarily the best for patients with high blood pressure. So there's a product called Coricidin, HBP, that typically, like a cold, cough, flu types of symptoms, is more recommended for patients with high blood pressure. But generally, like expectorants, like Mucinex, those things, there's not a lot of side effects, thankfully, for those. But again, be mindful to read the label, the warning signs, and always ask your questions. I guess the goal for us is you never want to take more than one type of OTC medicines that are written for the same types of treatment, like the same indication. You want to make sure, especially your cold products, you're not buying 2 different cold products, because most of the time they have the same ingredients, especially the Tylenol and some of the other inactive ingredients. So keep in mind, always read the labels.
So for the cough medicines listed here, which one would you all recommend would be the best?
That's a good question.
Well, you know what I can say? I'm not a big fan of dextromethorphan. Well, that's and I'm not necessarily a big fan of diphenhydramine. And we'll get to the reasons as far as the diphenhydramine, but dextromethorphan is a cough suppressant. Ricky,
I would say these are the over-the-counter ones, right? So there's other cough suppressants.
There's other,
Yeah. So, but for the over-the-counter ones, it's actually quite simple. It depends on what kind of cough you're having and what are the symptoms of your cough. So if you're having a cough, which you have a whole lot of phlegm, and you're having a difficult time bringing up that phlegm out of you want an expectorant, right?
Yeah.
So guaifenesin, and the brand name that's usually associated with guaifenesin is Mucinex.
Mucinex, yeah.
Yeah. You want to use Mucinex for that. But if you having a cough that's not associated with a lot of phlegm, it's more of a dry cough, and you're not trying to get something out, but you're just trying to stop coughing because it's just a nagging cough, kind of. Then dextromethorphan, which you'll see in a lot of products. There's hundreds of products, but you'll see Delsum as one of the Robitussin also as well. But these are the medications you really have to pay attention to the active ingredients, because they'll mix them both together. They'll have one, they'll have something else. but you want to know what you're looking for in a cough product. Are you trying to get out that a lot of phlegm that is really disturbing you, or are you having this dry hacking cough that is just nagging that's there? So it depends on those two. Yep.
All right. Thanks for answering that.
No problem.
Allergy medications. There's quite a lot over the counter. We listed most of the frequently purchased over the counter medication: Zyrtec, diphenhydramine or Benadryl, Allegra or fioxifenadine, levocetirizine, Xyzal, or Claritin, loratadine. They are equally effective, I will say. There are some that are more sedating or may cause drowsiness more than others. Zyrtec generally is a safe option for allergies for adults and also for children as well, with no necessarily major side effects. But again, nothing comes without side effects. So always pay attention to, report. There's some warnings. The warning labeling. Diphenhydramine is most likely the most sedating out of the bunch. In the elderly population, I generally don't recommend that. It tends to have like an opposite effect in the elderly patient population. So, and I don't recommend, especially children, the mothers that are online. A lot of mothers try to put their baby to sleep by giving them Benadryl. I'm not a big fan of that. And I don't think it's necessarily a good habit because there are side effects associated with it. So as far as like allergies, if you have an allergic reaction, if it's like food related allergic reaction or drug related reaction, and if you have Benadryl at home, it's a quick medication to give you to suppress the allergy symptoms that the body can generate. So it does work very fast in the sense if you have an emergent allergic reaction and you've of course you've called 911 and they're en route, it is a medication that is good for that. But as far as allergies in the sense of seasonal allergies, your Zyrtec, your Claritin, I think Xyzal is expensive, right, Rick?
Yes,
one of the new ones, yeah. But I know with these class of medicine, they can cause, besides the drowsiness, dry mouth, sometimes confusion, for sure. So keep that in mind. Nothing comes without a side effect. So we have to be mindful of these class of medications. They're readily available, as we all know, but they do have side effects that we need to be mindful of.
So the emergency that you kind of mentioned could be like hives related to like seafood allergies or something like that.
Exactly. I mean, self-medicating is it doesn't come without any let's say side effect. But after calling 911, if you've had a major, if it's hives and if it's just localized hives, definitely Benadryl. That's nothing really to be too worrisome about. But if there's lip swelling or tongue swelling and you call 911 and exactly. I mean, Benadryl will help, but definitely call an emergency, call 911. Yeah.
The only thing I want to stress that Vicky said is that I do a lot of research on delirium. And delirium is acute mental status change that occurs in the hospital setting. And most of the acute mental state, and we look at a lot of time delirium in the elderly post-surgical patients. And Benadryl has what they call an anticholinergic effect, and it has the effect, like Vicky said, to cause confusion. So if anybody is on the line, or maybe giving Benadryl to anybody maybe 75 and older, it's not a good idea. You really want to avoid Benadryl or the brand name diphenhydramine, the one that's usually in a pink box, right here, in that patient population.
Yeah.
In that patient population. So yeah, that's the only thing that I would like to add to that.
So because of time, let me ask Dr. Eddie, do we have questions from the audience, Dr. Eddie?
Yeah, a special request.
Okay.
Can you take a painkiller and a muscle relaxant together?
Okay, I'll answer, Ricky, and you can add.
Okay.
It depends on the painkiller. So the answer is yes, only if you're not going to be driving or doing anything that's going to require you to be fully alert. Because a lot of muscle relaxants cause you to become very, very sleepy. And a lot of pain medication depends on which type and how much you're taking, can also cause you to be very sleepy and very confused. So the answer is yes, but without knowing specifics, I would say you want to be very careful. If you're in pain, you've had surgery, you need the the muscle relaxant part of the other medicine, and you need to rest. That's okay, because you're gonna go to sleep. So you're not gonna be up and walking around and being alert. So
okay. Do you have more questions or?
No.
Okay. All right. We may have time for maybe perhaps one slide, and then we can conclude. So this forces you to come back.
Sure. So we will. I'm going to skip some of the
Okay.
and just get to the last slide.
Okay.
Here. Is just in conclusion, OTC drugs, they are different. The misconception is that they work differently than prescription drugs. And that's not as they all are foreign substances that are entering your bodies, that are hitting your cells, that trying to mimic a response that to help you out, but that is foreign to your body. So it's not different. Medicine sold over the counter is completely safe and could not cause any side effects or toxicity. I think we've debunked that myth during this conversation. So I won't continue. I won't go in deeper with that. Reading the whole label is not really necessary. That is a lie. Please read the label. It is if the recommended dose does not work, just take more. Please do not take more without consulting your pharmacist or physician. The product can be taken as long as often someone needs it. I told the story about antacids. You keep taking antacids and you might have a malignancy or something of that nature. If there's a symptom that you don't know what the root cause of it is, you want to ensure you know what that root cause it is rather than treating the symptom. We have in medicine, especially in hospital medicine, there's something called, there's a theory that sometimes people are just treating symptoms. People are just treating numbers. You see a number, you treat. You see a symptom, you treat. But a true physician or true somebody who's looking at the patient holistically, it's looking at the entire situation and finding the cause. Just for yourself, you need to do the same. If you're not sure what the cause of the pain is, or the continuous issue is, find out the reason. Last point, it is important to talk to your doctor or pharmacist about, it is only important to talk to your doctor or pharmacist about prescription drugs. That is wrong. You need to talk to them about both. So in short, don't mix your OTC medications without talking to your pharmacist. Read the both active and inactive ingredients. Never exceed the recommended dose. Always use an accurate measuring device. The point about the table and teaspoons will bring back another day.
Yes.
But use an accurate measuring device. Patients with high blood pressure or diabetes who are pregnant or over the age of 65 should seek guidance from their physician or pharmacist before taking OTC medications. So other mothers that are greater than 65, please. And when in doubt, always ask your physician and pharmacist. I think that's one of the go-to.
All right.
So,
Okay.
yep.
I think there are more to be discussed.
Yes.
In your
Definitely
next
next
appearance,
month. Definitely. So Dr. Vicky, I know that you have, a ton of responsibilities. So I need you to take a look at your schedule and let Dr. Ricky knows so that he can look at his schedule. So if we know that you're not coming soon, then we're going to blame you, Dr. Vicky. That is probably your fault. But we thank you. We thank you both for joining our discussion this evening and letting our members know the importance of, knowing about OTC medications. And again, as I mentioned, we look forward to you coming back. Hopefully next month, we're hoping to conclude this discussion because we have a church program. So I'm sure folks are preparing for that. And so we hope that you'll be able to join us then. And thank you both for coming. As well, okay, did you have some closing words before they leave or?
Well, I wouldn't thank them because they are coming back. If I thank them, they would feel comfortable not to come back again.
Okay, well,
thank you, guys.
We thank you.
Thank you.
All right, have a wonderful evening.
Thank you. You too.
Thank you. Bye-bye. So family, I certainly hope that you enjoyed the discussion and We're hoping that they both come back, Dr. Drama and Dr. Martin come back next month to finish their discussion on over-the-counter medications. And as I mentioned, we do have a church program that starts at 8 p.m., 1 minute from now. So we hope that you do join in. And as always, if you have any questions or concerns, please send it to Dr. Eddie or myself at emcuandyourhealth@gmail.com. Again, that's emcuandyourhealth@gmail.com. Have a wonderful, wonderful evening. See you next time. Bye-bye.